Here in Kansas City, Mayor Quinton Lucas says he's frustrated with the state's COVID vaccine process. So now he's turning to the federal government. KCTV5 is tracking that vaccine. Our Betsy Webster is live at the Kansas City Health Department now with the brand new interview. Betsy?
Well, the mayor sent a letter today to the Federal Emergency Management Agency, essentially saying, hey, I understand you guys are doing some mass vaccination clinics in other cities. Can you put us on that list? Because we've got problems.
It's not just out of frustration, although there certainly is an element of that.
For weeks, the Missouri governor has faced criticism about the placement of mass vaccination events. Last week, Kansas City residents drove more than an hour to Clinton, Missouri, the state's mass vaccination event closest to KC. Before that, it was Sedalia. Today, a closer one opened in North Kansas City.
We need more of those in Kansas City. We need thousands of them. You've seen them on the news. I see them on CBS Evening News.
And you don't think the governor will get those done?
Oh, I think the governor can potentially get them done, but why would I not try everything possible?
That's why he sent this letter to FEMA saying in part that federally managed events will provide a fairer shot regardless of race, socioeconomic status, or access to health care, internet, or ability to drive long distances for vaccination opportunities. Missouri data show a far smaller portion of Black and Latino residents have been vaccinated than white residents. Last week, Missouri Governor Mike Parson defended the allocation.
Right now, you simply have to cover the entire state, and it's not one region shouldn't get more than anyone else. And that's what we're trying to make sure doesn't happen.
He also noted the majority of vaccine, about half, goes to hospitals. Mass events are just 20%, and health departments 10%. Lucas says that's part of the problem.
There is no clear prioritization schedule that they have to follow.
Not everyone has a doctor, and not every hospital is doing outreach beyond existing patients.
How we treat other infectious diseases is often through public health departments, through mass events, through attention to things, through clarity.
He said that is key, clarity. Now, we did write to the governor's office by email this afternoon seeking a comment on what the mayor said in his letter, but I have not yet received a response from them. Reporting live in Kansas City, Missouri, Betsy Webster, KCTV5 News.
Many asking for clarity tonight. Betsy, thank you.